Can unusual symptoms like clubbing indicate CF? Have you ever wondered if unusual symptoms like clubbing could signal cystic fibrosis? Digital clubbing is when the fingertips and nails become rounded and enlarged. This symptom can indeed indicate cystic fibrosis, especially in its classic form. Cystic fibrosis is a genetic condition caused by mutations in the cystic fibrosis transmembrane conductance regulator gene, leading to thickened mucus in various organs, particularly the lungs. In classic cystic fibrosis, patients often deal with chronic respiratory issues. They may experience recurrent lung infections, bronchiectasis, which is the permanent dilation of airways, and progressive respiratory obstruction that typically begins in childhood. Digital clubbing is one of the respiratory signs that doctors look for when diagnosing cystic fibrosis. It can serve as an important clinical clue. While respiratory symptoms are the most common, cystic fibrosis can affect other organ systems too. In milder or atypical forms of the disease, respiratory symptoms might not be as severe or might appear later in life. However, clubbing can still occur if there is significant lung involvement. Other signs to watch for include a chronic cough, wheezing, frequent lung infections, nasal polyps, and shortness of breath. The thickened mucus in cystic fibrosis can lead to chronic inflammation and low oxygen levels in the body, which contribute to the development of clubbing. Therefore, if clubbing appears alongside other respiratory symptoms, it should raise suspicion for cystic fibrosis, particularly in children or young adults. In summary, while digital clubbing is an unusual symptom, it can be an important indicator of cystic fibrosis, especially when seen with other signs related to the respiratory system. If you notice clubbing or any concerning symptoms, it is essential to consult a healthcare professional for a thorough evaluation. Early diagnosis and management can significantly improve quality of life for those with cystic fibrosis.